Welcome, everyone. Thank you for joining us today. My name is Diane Fabi King. I'm a senior advisor in the Division of the National Health Service Corps, which is in the Bureau of Health Workforce at Health Resources and Services Administration. This is the 15th webinar in our 2024 National Health Service Corps Empowerment Initiative, and it is Advancing Clinician Wellness and Health Equity. Today, we are continuing our exploration of organizational resilience with a focus on social support and team-based care. Our final webinar in this series will be Organizational Resilience, Grand Rounds presentations on August 14th. We hope you can join us for that whole series. This HRSA initiative was really designed to help you as NHSC participants and new clinicians in the field prepare for and to succeed in serving patients in health professional shortage areas. With that goal in mind, we recognize that our NHSC participants need, very dedicated and informed leadership to create a supportive and healthy work environment for them to succeed in their roles. We are grateful to you all taking time out of your busy days to join us and learn more about how to support your NHSC participants. We hope you can take some gems from today's session and start implementing peer support programming already at your site soon. I will hand the mic to Molly so she can get us started. Thank you so much for being here.
Thank you, Diane. So glad you were able to join us today. And thanks to all of you for joining us for the third webinar in our Organizational Resilience webinar series. I am Molly Mindbress. I'm the Associate Director of NHSC Educational Programs at the Association of Clinicians for the Underserved. I'm going to be your moderator today. Folks are putting their name and location in the chat, so if you've just joined us, feel free to do that as well. It's nice to see where folks are calling in from. We've got Atlanta, Brooklyn, New Orleans, Cleveland, Boston, and I'm here in Nashville. In this series, we've been exploring the National Academy of Medicine's framework of evidence-based and promising practices that have been shown to improve clinician well-being. In part one, we looked at organizational commitment, leadership quality, and workforce assessment with Dr. Rosandra Daywalker. Last week, in part two, we focused on policies and workplace efficiencies with Judd Mellinger-Blauch. And by the way, if you did miss any of those webinars, you can find the recordings on our webinar information page, and we'll post that link in the chat. You can also find the recordings from all the other webinars from our National Health Service Corps Empowerment Initiative this year. But today in part three, we'll be exploring ways that your organization can facilitate social support among your staff. We'll provide examples of informal social support as well as more structured and formal peer support programming. As Diane mentioned, our final webinar in the series will be a grand rounds on August 14th. It will be a culmination of all the content we've covered in the series with lots of really tangible, practical examples from Primary Health Network in Pennsylvania. We'll post the registration link in the chat now so you can sign up today. Really hope you can join us for that last webinar. So I'm super happy to introduce Dr. Joe Shapiro to you all today as our presenter. Joe is an expert in peer support and has published papers on the topic, especially as it relates to support for clinicians after adverse events like medical errors. We'll paste a link in the chat if you want to read some of those papers and also check out some podcasts and other webinars that Joe has been a guest on in regards to peer support and clinician well-being in general. In 2008, Joe founded the Brigham and Women's Hospital Center for Professionalism and Peer Support, where she served as the director for over 10 years. It's always really exciting for us to have someone so well-known in the field present with us. So thanks again, Joe, for being with us today. Joe is also an associate professor of otolaryngology, head, neck, and surgery at Harvard Medical School, and a consultant for the Massachusetts General Hospital Department of Surgery, and principal faculty for the Center for Medical Simulation in Boston. In 2018, Harvard Medical School gave her the Shirley Driscoll Dean's Award for the advancement of women's careers. She continues to educate and assist organizations in developing specific programmatic and educational approaches to patient safety and clinician well-being, such as peer support, disclosure and apology, professionalism initiatives, and conflict management. Dr. Shapiro received her BA from Cornell University and her MD from George Washington University Medical School. Her general surgery training was at the University of California, San Diego, and then UCLA. She did her otolaryngology training at Harvard, followed by a year of National Institute of Health Training Grant Fellowship in swallowing physiology. She was a faculty member in the Department of Surgery at Brigham and Women's Hospital for over 35 years. So lots of great experience that Jo is going to be able to share today. And I'm really confident you'll learn a lot from her. And there will be some opportunities to engage with Jo and fellow attendees throughout the presentation through polling, the chat box, and by raising your hand to speak. When I hand the mic to Jo, we will try and see if folks can introduce themselves verbally too. So we'll explain how to do that momentarily. But definitely make use of these opportunities to interact with one another today. So before I do hand the mic to Jo to get us started, I do want to go over a few housekeeping items. This webinar is being recorded, and a link to that recording will be emailed to you within 2 days. The slides for today can be found on the webinar registration page, which we'll link to in the chat, but we'll also link to the slides as well. If you missed any of our previous webinars, like I was saying earlier, you can find those slides, recordings, and transcripts on that same webinar information page. We will have time for a Q&A at the end of the presentation, and we will try to ask you some questions throughout the presentation to spur some conversation. And if you do ask questions in the chat during the presentation, I'll chime in and Jo will try to answer them during the presentation. If you can add your questions in the Q&A box, that would be really helpful. That's at the bottom of your screen. And if you do have a technical assistance question, you can contact our colleague Josh. He's going to post his information in the chat now. I see it's already there. Finally, polling will be used throughout the presentation using the Slido platform. So you'll have two options for responding. The first option is to take a picture of the QR code on the polling slide with your cell phone. And we'll go to the next slide so you can see an example of how to do that. You'll enter the password provided, which will take you to the Slido website for this webinar. You can also manually navigate to the Slido website by using the link provided on the slide, entering a numeric code, and then entering a passcode. Foster, could you move to the next slide for us so we can see the first Slido poll? Thank you. So you see that QR code. You can use your cell phone to connect to the Slido poll and start submitting your answers. Once you connect to Slido, it'll automatically update with all the future polls. So just keep that Slido window open and you'll be able to respond to the future polls pretty easily. We do know it'll take a few minutes to open up for folks to get their cell phones out. So we will give you some time to enter your responses. We'll be patient with you all, especially for the open text questions that might take a little bit longer for folks to enter their responses. But please definitely go ahead and try using the poll now, get it open. That would be really helpful so we can see who's in the room today. And we would love to hear your feedback on today's session. We'll post an evaluation survey at the end of the webinar, so you can let us know how we did and improve our trainings. To see closed captions, you can click on the CC icon where it says show captions in the bottom of the webinar window. And I see some folks are using the poll now. That's great. And I'm going to hand the mic over to Dr. Jo Shapiro now to begin our presentation.
Thank you so much, Diana, Molly. And we'd agreed beforehand we're using first names, so I hope that's okay with everybody. I'm just very, very pleased to be here. Mostly, and the reason I think then all of us are busy. I know you are. Showing up on a summer day is really impressive. I wanted to, honor the kind of work that you do because it is so important, and I hope you feel the love and support that you have from all of us in the field, generally, who know that the work that you're doing in particular is in many ways more challenging, probably sometimes even more rewarding, but certainly challenging. So thank you for that. I also want to point out that if I look different from the picture, it's two reasons. One, that was taken a while ago, but also I'm just kind of still in my fourth COVID episode. So I haven't really left the house, over 10 days. So if I sound kind of weird or look weird, that's why. I don't know what it is with me and COVID, but we have a special bond apparently. I did want to ask if anybody would be willing in the chat just to put in what you do, and also just one thing about like what drew you to be with us today. Or if you just want to put your role, what you're doing, that's fine too. So maybe that's probably the easiest way if you can just write it in the chat.
And from the poll, it looks like we do have some scholars in the field, but also and students in service loan repayment program participants, HR staff. And can you see the chat, Joe?
Oh, let's see.
We've got an OGBYN resident.
Oh, great. Wonderful. Great, Giselle. That's wonderful.
Oh, and do when you're submitting your entries, make sure the 2 says everyone. I think that last one might have just gone to the host and
Oh, it
parents.
did. That's true. Okay.
Yeah.
Yeah,
Catherine is provider recruiter for critical access hospital and health system.
great. And of course, I think even doing this webinar, this is an example of Instructor, great. Is we are we're isolated, all of us in many ways in terms of the practice of medicine, even and some of you more so than others, but there is an isolation that's just built in at this point, the way we practice, the way we can communicate. And I'm going to really be thinking with you about and teaching about ways to overcome that isolation. So, I mean, this is a good example is, okay, we're all, used to doing webinars in Zoom, where we're all in different areas, but there are ways even within these constructs that we can connect. So I appreciate your anything you put into the chat, or if you have a question, you don't have to wait till the end of this. I'm not going to be talking for 2 hours. And also with that, we have a bit of a smaller group, which is fine and great actually. So probably won't take us the full 2 hours, but I'm here to serve you, not to get through my PowerPoint. So just please know that. So let's move on, I think would be good. And then anyone can go ahead and add things. So these are learning objectives. Bottom line is we really want to think about how to maximize support for you all in the workplace. Next. Yeah, these are some definitions of resilience. I think the most important thing I want you to take from this is the word resilience actually can be defined in different ways, but as growth through adversity. Growth through adversity. So I don't care how great your organization is or my organization, we in healthcare in particular, we are going to have some acute and chronic stressors that are just very different from what people who aren't in the field have. And so the idea of resilience, I think, should be taken at its core, which is, how can we facilitate growth through these stressors? I do want to comment that when I think of well-being efforts, and I've been involved in them for a long time, I think that in the beginning of when we were talking about well-being in medicine, which was, by the way, way later than we should have been talking about it decades ago, but nobody seemed to think that our well-being mattered. Right? And so now, of course, there's all this data saying it does matter. It affects everything we care about. And I think that there's lots of ways to get at well-being, okay? And I think of them in 3 overlapping Venn diagram circles. One is what we are calling resilience, which is, again, growth through adversity. And in the beginning, we were thinking of I think we being the medical profession, we were overemphasizing individual resilience. And so we were sort of telling everybody to go meditate and practice yoga and do volunteer work and, have this practice and that practice and, cook your own healthy meals and train for the marathon. And people got pretty cynical about that for a bunch of reasons. Not that any of those is bad. They're great, but the thing is, people get cynical when you tell them to do things that they don't. Then you structure their work environment, their professional environment in a way that doesn't allow for that. So you got that, and then also, it's not fair to ask us individually to bear the sole responsibility for resilience and for our well-being. It's really has to be more inclusive. And so I put the other Venn diagram, again, this is just my concept, I'm very visual, being a surgeon. And the other circle is relational work. So what are well-being efforts that actually pull us back into community? Because as I was mentioning, practicing medicine can be pretty isolating in many ways, just because of the structure of it. And so there are well-being efforts that actually try to, get us back into whatever different communities there are. And I don't mean outside of work necessarily, but I mean even within our professions. And the third would be organizational resilience, as this webinar is part of thinking about, which is that, at some point our organizations have the moral responsibility to support efforts that improve our well-being. So where do I put peer support? Because that's what, at the end of the day, what we're really focusing on today. And I made the Venn diagram. So I put it in the center of those three circles. It can be structured to help an individual develop resilience after exposure to a chronic or acute stressor, workplace stressor especially. And it is done by a colleague, which by definition is relational and collegial. And it should be, in my opinion, resourced by the organization. So it has an organizational component as well. So it's all three really when you think about it. That is a lot longer than I'm going to spend on any slide, so don't worry. Okay, next slide, please. So again, while we're talking about well-being in general, the National Academy of Medicine had these 6 domains of well-being, and I don't think you can avoid any of them. I mean, I think they're all important and multifactorial. So we're going to be focusing on number 6, support. Next, please. Okay, we're going to start with social support, just generally what that is, and then kind of laser focus in on peer support in particular. But let's just look at social support generally. Here's a good definition. Next. I'm assuming people have access to slides, so I don't need to read them out loud. But if I do, somebody just interrupt me. And please interrupt me at any time. I'm here for you. The idea is basically there's many support can be for different issues, right? Whether they're emotional or they're sort of technical, material, instrumental, etc. So it's not really just one way of giving or getting support. Next. Lots of benefits. We know this just on support data in general, in terms of, wherever you get support from. It's all good, really. There's no downside of support. Next. I'm not sure someone could think of one, but not really. So let's talk about your social support outside of the workplace. We all have the way I look at it is when I'm doing peer support is I already ask the peer, so who helps you? Like, what's your support community in general? And people usually have some answer. So what would be your sources of social support outside the workplace? We'll focus on outside, then we'll ask you about inside. So I think, Molly, do you want to help run this?
Yes, sure. And so if you haven't opened up Slido yet, you can just use your cell phone and that QR code. And then you'll have to put in the passcode to join the Slido. You can also do it from your computer. Go to slido.com and enter that number there plus a passcode. But yeah, who are your sources of social support outside of the workplace? So we've got someone saying their fiance and close friends. chosen family.
Neighbors, family, great.
Mhm.
Family, friends, spouse, wonderful.
It looks like that's all we've got for now.
Oh, that's
but
great. That's
yeah.
great. That's
Mhm.
really, thank you for those of you who were able to put that in. Yeah, these are wonderful, wonderful support sources.
Oh, we got one more coming in. Oh, Pat.
yes. Pets. They're the, I'm a dog person, so I'm biased to one particular. Okay, that's not fair. Next slide, if you don't mind. Okay, so thinking about the workplace, if you think of people who, are social support for you, where you kind of would lean on or go to if you were stressed, is the way I would put it. Anything come to mind for anybody who your go-tos at work? Oh, residents, nurses I work with, great. Supervisor, wonderful.
And we got a few people typing, so should get
Great.
some more
Excellent.
coming. Office roomie.
That's good. Yeah, great. And locations, yeah, okay, great. Yeah, I mean, how great that people who are supervising you are also your support, because that isn't always true. So that's wonderful. Department coworkers, yeah, direct team, actual people, doing the work with you. Wonderful. That's great. That's so good. Oh. And yeah, we do have work families too, thinking of it that way. Okay. Next. Okay, great. Okay, so then this is really just talking about ways to actually build that social support, whether it's within or outside of work. And again, we're going to talk more specifically about peer support, which is related, but a little bit different from this. So, this first one I think is really important. One of the things that I've noticed when I do peer support, and I ask people like, what's your support system? People will say it's my, let's say it's my partner. And then my next question is, well, have you talked to your partner about what you're going through right now? And so many times people say, I haven't, because I don't want to burden them, or I'm afraid they'll judge me. And my next question to them is always, if they were suffering, right, would you want them to quote unquote burden you? And everybody says, of course I would. And I'm like, well, they probably feel the same way. So, getting people to actually access their support systems is, it's one thing to have one, it's another thing to actually access it. So I think that's really important. And then these are, ways of sort of outside of work, thinking about, being part of, various communities. Next, please. Okay, so we're going to spend the rest of the time together talking about a very specific kind of support, which can come in different flavors, shapes and sizes as well. And that is support from peers. Okay, next slide. So just let you read this. I want to tell you, as an educator, why I don't read prose like when there's a lot of verbiage out loud when I'm presenting, so you understand, because most people do. And that is because we can read ourselves faster than we can listen to someone else reading. So if I'm reading this and you're actually reading it off the slide at the same time, you're going to be faster than I am. And there's going to be a disconnect. And it's a complete waste of time for me to be talking over that. I just wish more people knew that when they're doing presentations, but it's just something to tell you, explain to you why I'm going to have you read this yourselves. Obviously, if I'm not giving enough time or what have you, just, give me a hand raise. So there is something really special about, in a sense, unburdening yourself to someone who really gets it. And I've had so many people say, and I think we can all relate to this, is the people who they may normally want to go to don't really understand, or they can't really understand what it feels like. because our stressor may be so unique, right? It doesn't mean we don't need their help, or we don't want their support, but there's something special about somebody who you can talk to in addition to those other people who really, really gets it, who's been there. And I think that is why peer support has been shown with some studies, including some that I've published, is that's why we want peer support in the healthcare workplace, because our stressors, many of them, not all, but many of them are so unique to our workplace and a little hard for people to understand who aren't in that kind of environment. And so I just wanted to, never forget that, like never forget the power of peers. It's just really, really a beautiful thing. Next slide, please. So yeah, let you read this. This is actually talking about when you form teams, or when you have teams. It's really it does decrease the stress level for people to know what their jobs are, what their expectations are for what they do, and so it's a way of working with team development, and it underscores this idea of having people have shared vision and shared expectations of who's going to do what. Next slide. So there's a spectrum. I'll want you to read this slide, and then I'll tell you what the spectrum is. So this is the way I see peer support in particular. Is there's a spectrum of peer support, starting with informal peer support, and exactly what this slide says. You're sort of, checking in with somebody, and you could check in not necessarily after a stressor. You could just say, "Hey, what's something you're proud of accomplishing today?" But and the other examples are where something has been stressful, at least to you, or it's something that happened to someone else that could be stressful. You don't know if they're stressed or not, but it's a way of checking in with them. And I would say that I bet every one of you in this time together, I bet every one of you has done informal peer support. You're just checking in. And I think it's wonderful. So don't stop doing it. The problem with it is there's a couple of challenges. One is it may not be enough for a person, that if they're really going through something difficult, a quick check-in does not lend itself to somebody really being able to explore what's happening for them, right? It just isn't. It's not the setup. I mean, if you ask me how I'm doing after like a adverse event or something, I probably would say something like, I got this, I'm okay, I got this. Not because I am okay, but because that's the situation. I mean, that's the answer that's expected, and I expect of myself. And you're probably not expecting me to say, you know what, I'm miserable, I can't sleep, I'm wondering if I should quit, those kinds of heavy duty things when you're just doing an informal check-in. And another challenge with informal check-ins is, and I hope every one of you can relate to this, I absolutely can. We, especially in healthcare, we tend to want to fix people's problems. I mean, yeah, I'm a surgeon. You come to me with a problem, you're kind of expecting me to solve it, especially being a surgeon, right? It's not like I'm in the position often of just saying, wow, that sounds really hard, and kind of, just being there for you. I mean, sometimes, of course, but most times you have a problem and you want me to take care of it, right? Which is fine. It's great. It's wonderful. I love it. It's partly why I went into surgery. But I have really bad news, and that is you can't fix your colleague's pain. And so informal peer support, and we found this actually on a study, one finding on a study that we did, can be poorly received because inadvertently we're trying to minimize or fix our colleague's pain. Like, you should do this, or, oh, you shouldn't feel bad about that. That could have happened to anybody. That kind of reassurance, which on the face of it would sound reassuring, but it also minimizes someone's feelings. So informal peer support's wonderful, especially, if it's done well, which most times it is, but it may not be enough for everybody. So the other two, and again, it's a spectrum. There's no, delineation, but we're going to talk at some point, about formal peer support. And then there is actual professional longitudinal help, like from a behavioral health person or someone in, risk management or whatever it is, where somebody who's a professional in that realm is there to take care of you, and not in a way that's just a one-off, which formal peer support actually generally is. And so what I always I do a lot of training of peer supporters is to tell people who are I'm training, you're not a therapist. Now, for me, again, as a surgeon, nobody's ever said, are you a psychiatrist? I was like, nope, nobody ever asked me that. Because, I don't have the training for that. I probably don't have the personality for it either. My sister and brother-in-law, by the way, are practicing clinical psychologists. So I probably had more therapy than I ever signed up for. But the point being, I have a boundary with this. I'm not trying to take care of someone in the way that a trained professional would. I'm with them. I'm bearing witness with them, and I'm going to do some things to help them without either fixing or taking their stressors or their angst on as an ongoing project. I'm not their buddy. I'm not their mentor. And we'll talk about, those are all important things, but, actual formal peer support is not that. But I think, and for some people, formal peer support will be enough, but for others, they are going to need more longitudinal help or a more longitudinal relationship, even like in mentoring. So I just wanted to give you that idea of the spectrum, but let's look at just some of the aspects of peer support, some more in addition to informal. Next slide, please. So this is a it's a mnemonic to think about how to listen to someone, let's say even with, if you're doing informal peer support or, any kind of support to anybody is, this give mnemonic. Get that emotion is present. So if somebody might say one thing, but they don't name their emotion, but they're actually having emotions. Identify what emotions what they are feeling, validate their, what their feelings are, meaning like acknowledge it, and not, in a way that says, wow, that's kind of amazing you're feeling that way. That doesn't sound good. And then explore and understand, help them explore and understand what's going on. So this is sort of a basic mnemonic for any kind of support for anybody. It doesn't have to be peer support in particular either. Next. So it isn't fixing, although it is helping. I mean, that's the goal. You would like to be able to help somebody access their own what is called inner wisdom. And as I said before, it's not a replacement for mental health treatment. Yeah, so this module I actually wrote from the AMA, and it really just tells you how to actually set up an organizational peer support program. Next. So this is where, again, it's not formal peer support, but it's this slide is, titled group engagement, which is this idea that when I talked about the things that are relational, helping us with well-being, there's lots of ways to connect with others. It can be, and we know those of us who, get the opportunity to go to conferences, most of us often go just to connect with other people. It's not really, I mean, of course, it's for content, learning, but it's also just to be around and have these conversations with other people who get what we do. And, informal gatherings, same thing. Like sometimes we think, oh, I don't have time for that, right? I just want to go home, do my work and go home, which I totally respect. I feel the same way generally, but going to these other gatherings sometimes is so important because it gives us something that we can't get from either home or the workplace. And I think doing these strategically is really important. Next. Team steps, this is a sort of a structured way of thinking about, I'm not an expert in team steps, but it's a really good way to teach people how to be in a team and how to structure teams. And it improves teamwork communication, which then improves patient care. So it's sort of another way to think about being with people at work. And just an aside, the thing about all of our work is it's so fast paced that most of us, most days, can just afford to kind of come in and work, and then go home. And I totally get that. But it's important, and you all decided that because you're showing up here today, and I'm sure you have other things you could do, whether it's home or work. There's something important about taking time out to learn about or to be with other people, to learn about other ways of being together, or just to get more learning generally. And so I think these are really important. And Team Steps is just a very good program in terms of team functioning. Next. Circle Up was this concept about in the workplace, like how do you improve communication? Not just about like, I need to talk to you about this patient, but about your experience and the team's experience in the day, how you can make the flow better. And so the idea is, and it uses simulation principles, which is that you don't just come into work and start working. Like you actually take some time, and it's time well spent because it will save you time, lots of time during the day, is that you have a briefing or a huddle where you get together with people and you go like, all right, what are you all worried about today? Or what's the most problematic thing today? Or how many people are in labor? Giselle knows, these sort of briefings often happen like in transitions for OB, but they could and should probably happen in the workplace, whether it's clinic or what have you, is just to say, hey, we're gathering together. What do we anticipate? Maybe something has happened in the community that you think might affect the way your clinic runs and people coming into clinic, whatever it is, to acknowledge that in preparation so that you're all on the same page. And then the idea is during the workday, occasionally doing what would be, kind of mini informal peer support. Hey, how's it going? I know that we just had 4, admissions. How you holding up? Anything you need, right? Those kinds of things. And then at the end of the day, doing a debrief. A debrief, again, none of this should be taking a whole lot of time, and it is a time saver when you do it, is what are the things that we think went well today and that we want to keep doing? So you kind of remember, oh gosh, this did go well, and what are the things that we think didn't go so well and we'd like to change going forward? What do we need to do next that's different or the same? And this is how we learn generally. Isn't by just repeating the same things over and over again. If you're learning a task, it's actually reflecting on the task and your performance, essentially. So the equivalent here is, how did the team do? What do we want to honor and what do we want to improve? And I'm talking like it can be 5 minutes. So I think this is a really important rubric. Whether you follow it exactly or not, that's not the point. The point is to look at work as not just a place where you run in, do your work, and then you just leave because you haven't had any reflection time or prep time, essentially. And again, I'm not talking about a lot of time, and it is time well spent. Next slide. Schwartz rounds have been around for a long time, and they're done very variably, I would say. But ideally, they're when people come together to talk about a case and how it affected them. And not just them, but really on, as it says on the 3rd bullet, emotional, ethical, and social impact of a case. And it's a nice way to sort of look at a case or look at clinical scenarios from a different angle. Next. Valent trainings, valent groups are basically groups of people that get together. It's usually, I've only heard of them being done in internal medicine, where they're case discussions, right? Often, and you're going to explore a bit more about the patient provider relationship. It's sort of focused on that. It's not the same as peer support, but you do have peers gathering to talk about things that are, important. So it does have an aspect of peer support to it. Next. This is another thing called Doctoring to Heal groups. I'll let you just read this. And again, it's this idea, in a way, this is an affinity group, right? It's just getting together with people outside of the normal workday, to talk, to relate, maybe to discuss specific questions. Yeah, okay, next slide, please. Okay, the rest of the time I'm going to focus on formal peer-to-peer support programs. Let me have you read that slide so I'm not talking over your reading. Okay, before I go forward, I just want to pause for a second. I really wish we could see each other, but it's okay. This is we're working with the constraint that we have in webinars, and it's okay, but I want to acknowledge it. Anybody have a thought of anything I've said so far before we dive into the specifics of the structure and also what happens in peer support and what's unique about it? Anything that's striking anybody, or you're confused about, or you don't like, or what have you? I just want to pause, and you can put it in the chat, or raise your hand, and we have a way of unmuting you.
Yes, if you want to come off mute, you can click the button to raise your hand, and we'll send you a request to unmute. We can also use the chat. All right, looks like Giselle would like to speak. Let's try this out.
Yeah, a little bit hard to see. A little,
Okay, we can hear you. You're unmuted.
okay.
Oh. Giselle, did you want to say? Oh,
Mhm.
you're unmuted if you want to chime in.
Yeah.
Can you hear me now?
Yeah.
Okay, sorry, it was like connected to my headphones or something. But I was just gonna say that I think that the "you're not a therapist" part is really interesting, because I think that often when we're trying to provide peer support to people, that actually both ends up being the deterrent for someone telling us what is going on with them, but also the deterrent for us to asking what is going on and like how we can help. And yeah, I think I really appreciate you pointing that out, because I think it's the thing that makes it hard for us to both like seek support and then also want to provide support, if we then in turn feel like we don't know the resources to be able to provide that support.
I'm so glad that you brought this up, and it, highlighted it. And is Giselle, am I saying your name right? I want to make sure I don't keep.
Yes. I also recognize you because of the ACOG conference. I was like, where do I know her from?
Oh, that's so nice. I spoke at their national conference. So yeah, I think you pointed out both sides of the coin, which I hadn't thought of thinking of, together. And that is that, especially as healthcare providers, we're like in some ways appropriately obsessed with our training and our areas of competence and what we're allowed to do and all that, which is good. And I mean, we need boundaries. Like, you don't want, again, me being a therapist, and I probably don't want you, doing like plastic surgery on my face or something. I mean, you probably do fine, but
Right.
and so that I think generally, like, those are good. Like, those boundaries are really, really good, and they always need to be reiterated when you're doing training for something like this. But but they're not really as rigid in that sense as they our people think that they are. And that is that you can really support somebody. You can actually even not just, bear witness, you can actually help them begin to start to heal from something based on your peerness, and your training and being a peer supporter, and your willingness to hold and bear witness to somebody's pain without being a therapist, right? And so there's so much we can do that is way short of being someone's therapist, that we should, that's, part of what I always want to say is like, why are we not doing this? And, you really kind of answered it, which is like, we're afraid. We're afraid either to seek, because what does that mean? And I'm weak and all that. Also we're afraid, to give that because we don't want to cross the boundary. And I'm just here to say that, there's a very clear boundary between those things. And the other thing that what you said really reinforces is there are some people, physicians, one of them in particular, two of them actually, are Mass General Hospital, who've kind of gone public, gone on record with their mental health issues. And one of them, she's a pediatrician, and she really was severely depressed and quite near suicide. And what she reflects on, she got help. She's doing beautifully, and she talks about this a lot because she's trying to help educate people. Is she said almost nobody at work asked her how she was doing, including times when she said on reflection, she was really, really disheveled and clearly suffering. And, just to Giselle, to your point, that's why, because I'm sure, she didn't interview people like, how can you never ask me? But, I think people are afraid. And so I'm so glad that this resonates with you, because it's like, just ask people. And if somebody tells you something, whether you're doing informal support or a formal peer support, and you don't either know the answer or you're worried about it, say, I'm worried, how can I help you get professional help? Or how can I help connect you to somebody who can help you through this? I don't want anything bad to happen to you. And so, yeah, there's so many ways to handle it, but it doesn't involve your knowing how to screen for suicide or, become a substance use disorder expert or, become a therapist. So thank you. I
Yeah.
on a long riff on that.
No, yeah, that is exactly sort of where my mind went as well, because I think that especially like on this new slide, when to seek help, example, suicidal ideation, like I think that our field specifically is so reactionary to, when another physician like takes their lives, instead of literally just asking somebody like how they're doing and then trying to like figure it out with them. It's just, yeah, so that kind of was what I was thinking about, like with the you're not the therapist, and also all of that is like, yes, we should respect our uh like boundaries within our specialty, but also like remember that we're human beings and that we can just like ask each other human questions, like how are you doing, actually?
Yeah, exactly. Thank you. Well said. Well said. Anybody else have any thoughts before we delve in a little bit more to formal peer support? So also full disclosure, originally I'm from New York, and so my pace is like about 1.5 to 2 normal. So, if I just blow through, you were gonna say something, but I just went on to the next thing too quickly. Please just stop me, raise your hand, what have you, chat, whatever you need to do, and say, I just thought of this. I know you asked it, a minute ago. So keep me on target here in terms of meeting your needs. Okay, next slide. Okay, yeah, this is just two different resources. Obviously, I didn't put the slides together originally, so I'm not here to advertise my work, but I did happen to do that first one. And then yeah, the mental health first aid at work, like this idea of you don't have to be a mental health provider to inquire about or notice and inquire about distress. Great segue after what Giselle just said. Okay, next. Okay, so let me let you read this. So if you have experienced support amongst your team members, and again, for clinicians, think of your care team. Obviously, you can define team in so many ways, but for non-clinicians, just whoever you, consider your work team. How have you noticed that they or you provide support, and what the benefit of that is? And again, we're not talking about formal peer support, but just generally, like how do you see that showing up in the workplace? Type on.
So,
Mm,
someone has submitted, yeah, asking, is there anything I can help you with, and actually meeting? Kind of like what we were just talking about.
yeah, that is a beautiful question. And I love the specificity of it too. As opposed to how are you? I mean, not that how are you is a bad question to ask, but it's just sort of general and it doesn't really lend itself to somebody saying, I think, really specifically what's going on with them. So I love that. Um, yeah, wonderful. So just stepping in, right? Stepping in, having someone step in for that person. Oh boy, if that could happen more often, the world would, our healthcare world would be a better place. Right? People sometimes need a break, not because they're weak or lazy or anything that we may think ourselves to be if we just need a break, but because we're human and we care, and sometimes we don't have the bandwidth to do something. And yeah, there you go. I'm going to tell you a story about that in a second. It's very revealing of my knuckleheadedness. So let me wait till we get more answers there. Any other noticing? Oh, how great. You check in with each other and you have some planned outside activities. Clinician breakfast. That's so great. And if you said, someone said like, would you have time to have a breakfast? People would be like, no, but you do, and it comes back 100-fold in terms of how good you feel about working together. That's absolutely wonderful. Yeah, I love the idea, this one, of having a decided in advance workflow for helping someone out who needs a break. Because then you don't have that scrambling or this high bar for someone to say, I can't possibly take a break, because it would mean, chaos, right? I think that's so smart. And if you think about it, in some ways, a lot of this is like absolutely crazy if you don't do this. I mean, it's just inane that we wouldn't be thinking that at some point, every one of us at some point is going to need a break. What is that going to look like? And what's the structure for us to actually honor that, instead of making people work through it and then burning them out? Thank you. That's great. Just wait one more minute. Okay, Molly, is anyone typing, or should I go forward?
It doesn't look like it. And you were going to share an anecdote.
I just
Oh,
wanted
yeah.
to see.
Okay. Yeah.
But this is off script, obviously. I don't have a script. It's I'll tell it to you, and then I think, and I'll tell you why I'm telling you this now. And it's related to this idea of like being reluctant to ask for help. Okay, so I'm an expert in well-being. I am. I've been doing this for years. I've thought of so many ways and blah blah, and I do peer support programs. I'm an expert, and I think I'm going to acknowledge that for myself. All right. So I was scheduled to do a remote, it was supposed, year 2 or so post-COVID, so I was doing almost everything by Zoom. I was scheduled to run a peer support training for a group of, multidisciplinary group of clinicians at UC Irvine. And okay, good. I had worked with them before and was really excited to do this. And okay. So the weekend before that, it was scheduled for a Monday. the weekend before that, we decided, my husband and I and my sister and brother-in-law decided we arranged to go and visit my aunt in Manhattan, where she's lived forever. And we hadn't visited her there since COVID. And so it's probably had been like over 2 years. And we had an amazing time with her. She was 94. She took us to a Broadway play. She would never take taxis, just didn't want to waste the money. So she was like up and down the subway stairs. We must have walked miles in Manhattan. We went to a friend's house for dinner. She's just so vigorous. We had a great time. And so uncharacteristically, we had in advance decided to stay over on Sunday night. Usually we would head back home, but we, had advanced. We're gonna stay over Sunday night. So my husband and I stayed over in her apartment, my sister and brother-in-law at a friend's apartment. And my aunt comes out in the morning and says, and by the way, world traveler, she'd scheduled, I think she was going on a trip to the Galapagos or something. I mean, really just has been all over the world, very vigorous traveler, swam at the Y like 4 times every week, just walked through Central Park for miles, totally vigorous. She goes, something's wrong. And she sits down at the little dining room table and she leans over and basically, I don't know how else to put it, she dies. Like she's dead. No pulse, nothing. My husband's a pulmonologist, I am. So we get her on the floor and, do CPR, and it couldn't get anything going. Obviously, meanwhile, called the medics, and, they come, intubated, couldn't get anything, took her to Medics Hill. But anyway, she's dead. I mean, she died, right? If she could have lived, she would have, we were right there. So, okay, it is traumatic to, perform CPR in your tiny, but I also think we would agree. I will tell you that if I would, that's how I would like to go. No suffering with the people I love there. And if we hadn't been there, who knows when she would have been discovered, when she lived alone, the whole thing. Okay. So why am I telling you this? So I got this peer support training coming up, right? Actually for the next day. And meanwhile, I'm telling my sister, brother-in-law, like, everybody cancel your patients, your whatever, this is like, we're going to be burying my aunt, in 2 days. And, we're just going to be here. And, but I'm not canceling my peer support training. So I called the person who was running, this, and she happens to be a psychiatrist, head of graduate medical education for UCI. And I said, Dina, listen, I just want to tell you what happened because I'm going to be doing this from my aunt's apartment and I'm not sure how great the connectivity is. She's like, why don't you cancel? And I'm like, absolutely not. I'm fine. I'm doing this. We're going to just do it. It's fine. She's like, okay. So I did it. Right. And then the following day I was scheduled to do another one plus a big grand rounds. And Dina texts me and she goes, I know you're a grown-up, and you can make your own decisions, but I'm just offering you again the opportunity to cancel for tomorrow. And I was like, heck yes, I want to cancel. Okay. And we both I got on the phone and we kind of laughed about how idiotic it was for me, who would have told anybody, cancel. This is, you've got to take care of yourself first. You can't give what you don't have, like all the things I say to people. But I couldn't see that, at least for the first day. Like I did cancel for the second. And I'm telling you this because this is the culture, right, that has stopped us from taking care of ourselves or for reaching out or for admitting that maybe we need a break. Okay. And I obviously drunk, the Kool-Aid. I mean, maybe more as a surgeon, like, there are no crying in surgery and you have to keep at it, whatever. But, the extent to which I was a knucklehead, meaning like I wasn't following any advice I was giving everybody else, right? And made me, I love to laugh at myself. So it was an excellent opportunity to do so. But it was also great, reminder to me about how much that culture of I can do it. I've got this. I'm strong. I don't need help. I don't want to burden other people. I mean, one of the reasons I didn't want to cancel was I just didn't want to mess their schedule up, right? It wasn't because I was like being a showboat. I just didn't want to mess anybody else's day up. I mean, I do think your aunt's death kind of should supersede that. Obviously, I figured that out finally. But I just say this to you because everything we talk about and have talked about, it's in the culture that we've inherited in medicine which is, and Giselle really brought it up beautifully, which is that we're just, we're really, really hesitant to say, I need help, for lots of reasons, but one of them is just what we've been taught. Okay, that was a biggie, huh? Anybody have any reactions to that before I move on?
Thank you for sharing, Joe. It's a very personal story, but really highlights the importance of taking care of one another. And
Yep, and having to overcome that barrier of people not wanting to ask for help, and also to try to change that culture so that the first reaction is like, I probably should think about taking a break. Or I probably should think about getting help right now because, this is a good time to do that. And I think, and the way I look at peer support, it's not the only one to do this, but it's a culture change driver. It says we have a program in place, and to the person who wrote in, workflow for stepping in decided in advance. That's why I advocate for having a program for peer support. So it's not just ad hoc. It's there, it's available, and it's easy to put into place because our lives are so busy and our culture is so much directing us to not paying attention to our emotional or physical health that I think having a program or having a structure that says, no, we're going to take this into account, that these things may happen. What are we going to do about it when they do happen, instead of like at the last minute, oh my gosh, what do we say? So thank you for listening. Okay, next slide.
can I ask you a question real quick, Joe?
Sure.
On that note,
I
do
want
you
you,
know what,
when,
what's that?
when to go back, because otherwise people will be reading the mentor slide.
Oh, okay.
This is the
Do
thing.
you know how much work is happening like in med school, nursing school, et cetera, to change that culture? Because it seems like it starts, before you actually go into the field, right? In your training, it's so competitive and intense.
Yeah, it's a good question. Let me tell you why, by way of answering it, why I decided when I wanted to do this culture change work around well-being and respect and trust, why I wanted to do it at the hospital level rather than at my med school. Not that for me, they were mutually exclusive only because it was just me. And I I had to pick where to start it, right? The reason I think we have to at least start it and have it started at the hospital medical school, the hospital kind of post medical school place is the following. There's a lot that we teach medical students and nursing students, right? And every other kind of student in healthcare that is the right thing. And then they walk into the clinical world and they're like, oh, so that's how it is, right? And in a flash, what we've taught them becomes unlearned, which is normal because people are going to respond to the culture in which they are working, right? And so my thought was it's just going to get extinguished if we just do it in medical school, nursing school, APP school, etc. And so let's make sure that that world that the students then enter in their clinical years and beyond is the world that we want them to be part of. And so that was really the reason I said, let's focus on, in a way, it's much harder to do it at the, attending and even, resident level because, our ideas are so formed, but it is entirely possible to do. And I think if we don't do it there, you're going to waste a lot of your effort at the training level, early training level. So it should be yes and it should be in every kind of school, healthcare provider school, and it should be in residency, and it should be in the workplace with all team members of any kind, clinical or non. So for my thing is like you have to start somewhere, and that's where I started for that reason. And I say hospital, I mean the clinical world.
That's helpful. Thank you so much.
Okay, let's go on to a different kind of program. We'll come back to your support. This is, mentorship, right? Take a look at that. So mentorship is wonderful, and it's different from formal peer support in one major way, and that is it's longitudinal, right? It's something you commit to, and it doesn't have to be forever, but for some amount of time that you're gonna be working with this person or this group. And so, and there are a lot of people who've written a lot about mentorship and coaching and kind of the overlap and how to do that well. And I think that these are wonderful programs. Again, different from formal peer support, but really, really important. Next. And some specifics about that. And any program that you want to build in your workplace or be part of building in your workplace, I mean, and take it from the biased aspect that I am going to exhibit. But the thing that I think I hate is I hate people having to reinvent the wheel. And I got to tell you, there are some really well-developed mentorship programs, based on some science and also experience. And that's not what I do. I do mentor, but I'm not, I don't develop these programs. And so I would encourage anybody who wants to do, not that you have to have a formal one, but it's good to learn about what people who've had experience in developing mentorship programs have learned. How to be inclusive, those sorts of things, how to pair people with the right people, what is mentorship, what are the boundaries of it, what are the pluses, minuses, etc. But yeah, mentorship programs are wonderful. Next. Okay. Yeah, just take a read of this. So this is a summary slide, just sort of thinking about, more broadly about, how to have sort of workplace or healthcare provider kinds of support mechanisms. What are some of the options? And this is reiterating what we talked about. Molly, if can you show me what the next slide is? Because I want to make sure, because I don't think I want to explain something. Okay. Yeah, okay, before we get to that, let me just briefly tell you what a formal organizational, and I'm talking about, it can be a clinic, it can be a hospital, it can be a healthcare system, but this idea of having a formal peer support program, what does it look like, and what can it look like? Just so you know what I'm talking about. As one of these, it's not the only way to do this. That's why we have these wonderful other ideas. So again, peer support, the idea is that you're supported by somebody who, isn't like, it wouldn't be a behavioral health person, because that person is not going to be experiencing the kinds of things that you are experiencing. You may need that person. As I said, it's a spectrum, but peer support particular is given by somebody who's been there, if you will. So it would be, I mean, I've done it, I've helped, hundreds of organizations start peer support programs, and it can be, tiny, it can be multidisciplinary, you're training, people from all the different parts of the healthcare team. It can be just for residents. It doesn't matter. I mean, it's whatever your organization has the bandwidth to do. I'm always a multi-D kind of person, so I prefer that, but there are plenty of organizations where they just don't have the resources to do it for more than one group or whatever. That's fine too. But anyway, the idea is you're going to train people within different specialties. And what I also think is important is to have different have it be very inclusive. So you're not just training women or men or even binary. You are not, I mean, that you're including people from different races and different stages of career. Because you get different perspectives from that. And I think it's really, really important. So you have a group of people that are, I would say, ideally, are chosen by their peers as someone that they would want to go to when you say, we're going to start a peer support program here, right? And so you explain what the program is going to be, and please nominate up to 3 people that you would want to go to be, become a peer supporter. And then make sure that they want to do this. And I think this is really key. I'm going to say this probably more than once. You can't it would be awful to burn out the peer supporters. So you want to structure it so that you're not asking the peer supporters to do this every week. And, my kind of general rule was do it like call on an individual no more than, once a month or, even like just 10 times a year. And each intervention that you do for peer support is a one-off and it's about an hour. So, asking someone to do something for 10 hours a year probably isn't overly burdensome. And I can tell you I've done tons of peer support. Yes, I put myself right out there. It's so important to do that. But I end up getting more than I give is what I would say. It feels so replenishing because the person's usually, well, first of all, outwardly appreciative, but even if they're not, you're giving back in a very particular kind of way and in an evidence-based way too. And plus it's a set of skills that I think can be used for any kind of support of anybody. But that said, you don't want to be asking people to become a buddy or to become a mentor or what have you. Just, formal peer support is emotional first aid. It's about 45 minutes or an hour with the person who has identified themselves or you all have identified, somebody else has identified as having been through a stressful circumstance and maybe, and not even knowing if it's affecting them, but offering the support, ideally, that something happened, patient aggression, being named in a lawsuit, adverse event, or just some kind of chronic workplace stressor, something that, these things happen in our world. And then there's should be a reach out to say, and here's how I do the reach out. I'm reaching out to Sam Smith and I go, Sam, I email Sam and in the body of the email, it says touch base. In the email, it says, hi, Sam, I'm reaching out as a peer supporter. Give me a call when you get a chance. And then Sam calls me and says, what is this about? And I go, I don't know if you know this, but we have a peer support program and we reach out to anybody involved in whatever it was, let's say adverse event. And the reason we do is because I and every colleague I know has been there. And sometimes it's really stressful. And some of us find it helpful to talk to a colleague. Is that something you'd like to do? So I'm not making Sam crawl down the hall and say, I'm miserable, help me. Although you want to make these programs with a cultural low bar to accessing support so that hopefully Sam, if there's something happened, their first reaction would be, oh my gosh, I know there's peer support. Let me get some. But until that happens, it's good to also have a reach out component where it's a proactive reach out. If you hear about something, if you don't, you can't reach out for something you haven't heard about. But people react really beautifully to the reach out, even if they say, I'm good, I got this. They often say, well, thank you for checking. I really appreciate that. And then you offer them, even if they say no to the peer support, hey, I have some resources I can recommend. Or if you want to just tell me if you want further help or support, let me know and I'll find out what some resources are and get them to you or to any of your team members. So you're going to be the conduit. You're not the person who's going to do the further resources kind of thing. You would do the peer support if they want it, and that's that. And so then I train. I mean, in my concept of peer support programs, I train. I mean, and I'm biased. I think training is important, but it's really just like a 2.5 hour training session. Part of it is most of us, I'm trying to train out that sort of fix it mentality. Where you take on the person's pain or you try to minimize it or any things that we do out of the goodness of our heart that doesn't work well. So there's some training, but no certification or anything like that. And then people who want to be peer supporters would be peer supporters. It's not expensive. It's just very well structured is the way I would put it at organizations so that it's there. And nobody's panicking or just forgetting about it. I can't deal with this event because I got to go to work or I don't have time to ask my colleague because I don't want to bother them or what have you. So that's my concept of a formal peer support program. But again, the concepts I teach in training as a peer supporter are really generalizable to any situation where you're sitting with someone who's been through something tough, whether it's acute or chronic. And it's some of it's validation and empathic listening, but some of it's also helping somebody explore strategies. Like it's very practical too. Okay, this is upsetting you. Let's talk about why. All right, let's talk about what would be your next step, in helping them think about within their healthcare organization. Who else could you ask for help about this? Do you need to talk to someone in, risk management? Do you need whatever? And then destigmatizing and facilitating referrals for further help that's professional and maybe longitudinal if the peer wants them, but nobody should be forced to be supported, wherever on the spectrum it is. That's actually, there's data to say that that's not a good thing to do. So that's a little bit more. I just want to make sure. So you had a picture of what, somewhat of what a formal peer support program is. But as you can see from this slide, it's not the only way to go. There's lots of ways to pull on sense of community and belonging and help with kind of the stuff that we deal with because of the nature of the work that we do. Okay. So now we have some more questions for you. If you could answer that. Molly, do you want to?
Yeah, looks like folks are jumping on. So is social support among coworkers encouraged and facilitated at your organization? And we do have that not sure option because there might be some sort of in between. And if you feel like sharing more, you could come off mute or type in the chat a little bit more about why you might not be sure.
It's encouraging to see a lot of people. It is encouraged and facilitated. I love that. It's really encouraging. Maybe we can go to the next question. This is a kind of a deep question in a way. I mean, we talked a little bit about, this idea that we just are so focused on, okay, caring for each patient, next patient, which is ultimately why we're doing what we're doing. But also our argument that doing that is facilitated by, taking care of ourselves and each other. And that involves prioritizing relationships within, our systems. Any ideas on that? How would that look? What would be ways to prioritize? That's good. Yeah. Yeah, this is, this one. Okay. I think I just want to agree with you. I think, every organization has to balance throughput, which is, the production pressure. Like we just have to see more patients. Like that's the only way we're going to stay afloat. The problem with that is it's not that it doesn't matter, right? But let me, ask you an example, like on extreme cases. If I were going to, this is a chat question and it's a number, okay? If your sole priority as an administrator, as anybody running a clinic or whatever, was to ensure that patients got the best, safest, most personalized care. In a clinic session, how many patients would you schedule me for or schedule yourself for in clinic? If the only priority was safety and quality of care, how many patients in a, let's say in a day, would you be scheduled to see? Just put it in the chat. Anybody?
Because they'll put 2 an hour.
Yeah, or maybe 2 for every 4 hours. If the only priority, right, was that, you'd be talking to the families, you'd be like, right, you'd be helping connect people with, other resources, patients with other resources, etc. Okay, so we know that no matter what anybody says, that is not the sole priority of the people who control the resources. It can't be, right? Because then we'd have access problems, right? No less financial problems. So obviously, at all times, there's going to be a tension between how many patients we see, right? And seeing people in a way that gives the best care and supports the well-being of those of us giving the care so that we don't end up leaving or, going part-time or, or practicing in a way that is not, relational or kind, and so those two things are always going to be in tension with each other, and they need to be balanced. And I think the problem that most of us see generally, even with enlightened leadership, is there's not enough of a balance to counteract the productivity pressure, right? And the access pressure. See more, see more, see more, see more. Even though what that's going to do, and there's data to support this, is it's going to mess you up ultimately because you'll have fewer people working because they won't be able to sustain the pace and that career and what that feels like. And the care that you give isn't as safe and it's not as cost effective and all those other things. And so I think, we know based on some published data about for example, the cost of not considering healthcare provider well-being is high. It's just a hidden cost where, you can see what it is like to just take care of all these patients, but you don't see the cost of not putting a limit on it to some degree. It's always going to be in some kind of tension. I'm not trying to say it isn't. So I think, you're talking this, whoever wrote this, fewer appointments per day, and then more space to care, and to conference and to debrief or to reflect. And we're not talking about having hours and hours of the day doing this or doing it every day. I don't think anybody means that, but it's finding time and space to make sure that happens. Because at the end of the day, if all you're thinking about is cost, it's still cost effective to pay attention to relationships and communication and teams. It just is. So thank you for putting that out. And yeah, I agree with the less burnout, less cattiness, more understanding. Yep. Because personally, I'm at my worst self when I'm exhausted, stressed. I'm not exactly the person I want to be sometimes. And, so what can we do to put people in situations where they're going to be able to be their best selves, and not every second, every minute, but, just on, longitudinally, essentially. Okay, next. Please. And we don't have to, give this like a known amount of time, but just, any ideas that your organization could do for anything that we've talked about. To pay attention to the relational aspect of care. That's relational within, the team, which then in turn gives us better ability to be relational with our patients. Any ideas? Yeah, we have 2 people. Oh yeah, cross team. I think that's so important. As others are typing, I think, again, this is sort of a cultural phenomenon that I don't think it's just in medicine, but there's a lot of sort of othering around teams, like our team versus, others. So there's can be inter-team collaboration, and then within the team, improving communication. Get together. That's, oh yeah. Yes, I agree. So these are great suggestions. like the last one, I'm such a fan of interdisciplinary. I really am. I mean, when I think about, just this is anecdotal, of course, but I think of my own career, and just especially starting with training, was I don't think personally I could have gotten through my training certainly as well as I did, if you will, as relatively unscathed, if it wasn't for the nurses. I mean, they really took care of us and the patients and helped us take care of patients. And that's just one example of, interdisciplinary, but there's so many. And yet I see a lot of othering, with both from all sides of all different groups. It's just a waste of time. Yeah, workshopping workflows, that's great. Yeah. I have it's just another thought, is the people who are giving the care, if you really sit and listen to what they would suggest about how the care should be structured, they know. Most people know. Not all the problems are going to be solved. I mean, we're going to struggle with access. And those need to be, thought of as, they're very complicated, for example. But as far as like actually improving workflow, which also will positively affect access, the people, on the front lines, they do know. And I think the idea of like having a place where people can actually come up with ideas to improve the workplace, to improve the workflow, would be amazing. Yeah, so thank you for all these suggestions. Yeah, ups and downs of physicianhood. It's like there are ups and downs, and just talking about it with others and people putting out, their thoughts about what's helped, what hasn't. So valuable. Great. Agree with trainings being what you do. Anything else? And let's go to the next. We can probably, Melanie, if it's okay with you, just kind of read through this case. We don't have to do a ton about it, but let's read through it.
Yep, that would be great. We do have some Slido questions
Okay. Yeah. Let's go.
about it. Yeah. Mhm.
I think that's enough. Right there. Okay, so transferred to a new type of site, feels kind of isolated, doesn't have that knowledge of or connection to other, other people. What could they do? She do? So I don't know if we did this.
I think it's she, but yeah, I can't remember. Oh yeah, given her current challenges.
Okay. Mm-hmm. Yep. Yep. I mean, surprisingly doable, even in online. Yeah.
And I think this is particularly relevant for NHSC participants, since they often are going to communities that they don't know at all. They might be moving across the country. They might be going from urban to rural, south to north. It can be isolating.
Yes, that is very isolating. It just is. Yeah.
Looks like we've got a couple of people working on a response. I'll speak to a previous presenter, Dr. Keisha Callan. She was a National Health Service Corps participant and practicing OBGYN in rural Georgia. And she takes every opportunity to get to know folks in her community and sort of take on leadership roles in her community too, volunteering like with the library or joining different community groups, because one, I think to make connections, just moving to an isolating area or new area, but then also to make connections so she can make referrals for her patients and relationships to initiate new interventions and programming.
Yeah, lots of ideas here. Absolutely. I think, the theme is to, she's going to need to be proactive most likely, because it's unusual to have a structured, welcoming way to, have people help them get these set up. And that's okay. I mean, we'll change the culture, and eventually it will be baked in where, of course, when someone comes, we help them think about how they could best feel welcomed. So, but this is, I think, there's going to have to be a degree of doing this on one's own, getting it started on one's own for oneself.
And we just got a request to
Next
read
slide.
to read some of the responses, since someone is just doing audio only.
Oh, I'm sorry. Oh my gosh.
Okay.
And I wish I knew that, because I would have had people just, oh my goodness. Okay. Look for caregiver support. Though it isn't her work environment, it is part of challenges she's facing with, which others in the community may identify with. Another idea is asking new coworkers out to dinner so she can create new support. And then another was online/virtual connections or affinity space. Okay, next. Can we do next, Molly? Great. Dr. C decided to engage in virtual professional opportunities, restored a sense of connection and support, found a community of healthcare professionals through Project ECHO, felt energized by peers online, and I'm not sure what ECHO is, so Molly, can you just...
Yeah, it's a program, and I think it's in Arizona or New Mexico. I'm blanking at the moment, but it has a national reach, and it's a way for healthcare professionals to come together and communicate with one another.
Great.
Sorry, I don't have the information right in front of me to give you more details, but it's a great program.
Look it up. Yeah. Okay, next. What advice would you give clinicians starting in a new workplace to build a successful social support network? I sort of feel like we asked that. So is it okay if we move on that one?
Yeah, that's fine.
What challenges have you faced trying to facilitate social support within your organization? Anyone willing? It's anonymous, as you know, so anyone willing to describe challenges to facilitating social support for yourself, for others in your organization?
And I just put a link about Project ECHO in the chat if anyone wants to check it out. I'll chime in. I know at our organization, we've tried to facilitate some social support activities, and I think it's challenging with different schedules that people have, and also some people have different preferences for how they want to interact and communicate with one another, and online can be hard if you're remote. But yeah, it looks like someone's chiming in.
Yeah, I think this is the very old. So the leadership felt like building those systems or making space to connect wasn't a proper use of work time, which is kind of a very common but retro way of looking at the world. The larger overall culture where everyone is on their own. Yeah, so I think we've inherited a culture where it's like you do your own thing, and then we've also there's, I think, what I would call a myth that because our mission is taking care of people, anything that isn't literally directly related to patient care is not valuable. And what's busted that myth is like what I was referring to earlier, which is all the data showing that for example, if your healthcare providers are burnt out, they will not provide high quality, safe care, right? On the average, it's a risk to safety. It's a risk to patient care quality. And it's certainly a risk to the finances of the organization, because people who are burnt out tend to leave, right? And worse, there's depression, suicide, and even suicide. So it's at your peril as a leader. Do you ignore efforts to connect, have people connect within the workplace, because then it means you're not considering the effect it has on the patients, even if you don't care about the people in the workplace. If like at the end of the day, all you care about is patient care and you're a leader, you absolutely still need to invest in these programs to actually get people to connect, et cetera. I think the harder, the providers not wanting to participate due to burnout, I mean, that is like the ironic conundrum, which is the more burnt out you are, the less, bandwidth you have to do things. And I think, so ideally we're trying to prevent burnout, but we're also dealing with a high rate of burnout. So I think my answer to that would be just, first of all, not an answer, more of an acknowledgement that that is true. And so and let me just read the next one. The work of organizing social support is placed on clinicians or frontline staff. Burnout escalates through extra tasks. Yeah, this is why I believe firmly, I've always made the argument that it's the organization's responsibility to get these patients, to get these programs up and running. They're not that complicated. They can be done and they're not expensive, and don't make us do it because we're too busy doing the work. So make it easy for us to be there, to go to these programs or to use them. And that is really, I think, an answer to the person who wrote providers not wanting to participate due to burnout, is even if we're, because obviously you want to prevent burnout, but if people are already burnt out, if you make the programs easy, accessible, and also get people to at least try them once. Most people, once they are engaged in these things, they really see the advantage to doing them. And at the end of the day, you can't force people to do anything. So you have to acknowledge, like, there are going to be some people who they probably would benefit by the programs, but aren't going to want to use them, and that's that. But there are many other people who may be skeptical or on the cusp of burnout or burnt out, but willing to try. I've run lots of things where people were like, I don't know, I'll try it, and then they, give it great reviews, because it feels really good to connect with others. If the programs are well run, they are really enjoyable. Yeah, and you can't put the burden on the the people you're trying to serve to get these organized. Okay, next slide. Name one action step you can take next week to improve social support in your workplace. This could be at the individual, team, or organizational level. No question mark there. We just put that in by mistake. Sorry. Yeah. So can you think of, as we always like to think of, like, what is there? Do you have any commitment to try one thing to improve the social support in your organization at any of the levels? Anything, anybody, somebody's putting out something. So if any of you could try to think of one thing, it doesn't have to be mind-boggling, just even a small thing. Hosting a vision board party as we are halfway through the year. Oh, wow. That sounds fun. I would like to come. That sounds really cool. I'm just assuming, I know we don't have a great ability to have a back and forth and discussion, which I would love to do, but I'm assuming, and you can say if I'm wrong or not, that vision board parties, where you're thinking about, like, where are we going, how are we getting there, where do we want to be, that gets people to be able to blue sky, brainstorm, and connect. Party meaning like really all going to do this and have something to eat. I'm always about the eating, just as a way to connect with each other, but also kind of reignite this sense of mission, and then specifically, how are we getting to this mission that we all are now reevaluating and reconstructing. Thank you. That's lovely. We'll take it. Another one is identify a couple of people to check in on folks who experience difficult traumatic experiences, then work on training them on how to do check-ins. Wonderful. Wonderful. These are great ideas. Absolutely great. Absolutely great. I mean, I know as well as you do, it's so, it's easy to, you go to a webinar or a conference or, like grand rounds or whatever, and then you just walk out going like, yeah, I kind of agree with that, but then it kind of, you're subsumed into the world of running around like crazy. But I think maybe one thing I would just, semi-leave you with here is just this, a couple things. One is this appreciation for what you do already, like the work that you do is so beautiful, and maybe even you're taking time to appreciate that. That's one thing. And then the second thing is like looking at what's going well socially, support wise in your world, and seeing if there's any way you can either help continue that or also, widen that to other people, or if it's at home, make it in the workplace as well, those kinds of things. Is, just without putting more pressure on yourself, but sometimes working on these things actually does give you, give back more than it takes. So that's something I've found in my work. Okay, next slide. Okay, so I feel like, let me look, infographic tips for supporting your peers. Okay.
I can jump there, yeah.
Yeah, that would be great. And also,
Okay.
if somebody who doesn't have the visual is going to have trouble with this slide. So,
Oh, yeah.
so is it, can I do a last word before you go
Yeah,
in?
of course. Oh, yeah, there's still time. Yeah.
Okay, good. Yeah. So, I want to thank you deeply for the work that you do, and also for being willing to show up and to learn together and to think about, again, reflecting on what's going well and looking for improvement. Because that's a beautiful thing that you were able to carve that time out. And I think it's wonderful. It says a lot about you that you would do that. But also just to keep remembering the good of what you're doing. And also, and this is something I just want to say because it's been my experience over my really long career, is I'm just so happy and surprised about how much even entrenched cultures can change. And it doesn't have to be like a big revolution. It can be like, we're going to do this, like we're going to do this project, or we're going to do this one way of finishing, rounds today, or it can be at almost any level, but people do want, a better environment. They really yearn for it. And so thinking about being part of the solution, I think is, that's what I hope to leave you with. That sense of optimism that I feel like is real. So thank you again for inviting me and for what you do.
Thank you, Joe. I love that you ended on that note, and we still have time for Q&A, so don't leave anybody. But no, I mean, it's a really great transition into the next webinar, our grand rounds in August. We're going to have a team from Pennsylvania, from Primary Health Network. It's a network of almost 50 community health centers, but they're going to talk about how they went from a network of health centers that was really struggling big time, and in the last few years has totally transformed with new leadership and in really different relationship building practices and support of staff. So I really hope you all can come. But yeah, they didn't get stuck where they were, and they made a lot of really huge changes, and I think folks would really benefit from being there. But Joe, just wanted to thank you for all the not just the content that you shared, but really, helping folks understand it and how it can work in a practical way. I mean, when you were talking with Giselle, it really felt like peer support was happening right in front of us. And so you really modeled that well. So thank you so much. If folks do have questions for Joe, please throw them in the Q&A box. We did want to let you know that we have a couple resources from the National Health Service Corps Empowerment Initiative. So we have an executive summary on fostering social support to improve well-being. It kind of summarizes a lot of what we talked about today in the presentation. And then we've got an infographic on tips for supporting your peers. And that's just something you could print out and have in your office and just refer to easily. We are making updates to those, so they should be up on our website in the next week or two. And we can post a link to the publications page in the chat, so you know where to find them. And also we email you all when they get released anyway. You'll have that. We've also opened up the evaluation poll, so you can go ahead and start chiming in on how we did today. But we could go move to the Q&A slide. If anyone did have any final questions or comments for Joe, you're welcome to come off mute and ask verbally. But one thing I was thinking of while you were speaking, Joe, is I know I've read a little bit in the literature about how sometimes what we do in the workplace is we vent, and if you're just venting and you're not getting to a place of resolution or healing or next steps, it can be detrimental. And so I wonder if you could speak to that.
Yeah, I do think that observation is true. And somebody wrote like sort of cattiness, and this if it's great to be able to talk about what's going on, but it has to be more than that. In other words, having people come together. I mean, sometimes you can just say, let's just vent and just call it a day. We're just going to vent, and that's what we're going to do. But if you really do want to make things better going forward, I think structuring something to say like, what's on our minds, and what are the things, and I like to look at it both ways. What are the things that we are doing now that we want to continue and maybe amplify? Because there sometimes are things that we're not even thinking about that we're happy that we're doing. And that's important to acknowledge, so we can do more of those. And then what are the things that, if we're going to improve, we'd like to do differently moving forward. And this is like my mantra. I do it even, when I was doing surgery, which I did for 35 years, at the end of every case, I would ask the senior resident, tell me a couple things you think we did well and a couple things you want to do better going forward. And I would do the same thing and model that. Just this idea of always looking to learn and improve, which again, sometimes it's flat out, I just want to scream about how horrible that was. Okay, call that, but that can't be always the way we work through things. And as you can see, I'm a big fan of just being able to say, like, I'm just going to do this now because this is what I want to do, but I recognize, I think always saying what you're feeling, but putting it in context is helpful. So I appreciate that just having a place to say how horrible things are is not terrible, but it's not, in the long run, not that helpful.
Right, that can't be all that you're doing.
Yeah, that's absolutely sometimes. And how about the times that not only can we think of things that would improve our lives going forward, but are there people we can share those with who can make those happen? Or are they on us to make happen? Sometimes they are things that we need to do, but sometimes it's things the leadership needs to do. So is there that communication where, hey, we've gotten together, we have these ideas, that it doesn't fall on deaf ears?
And something you said made me have another question around, it's another culture shift, right? Of being honest about what's not going well. So have you encountered that in trainings and working with other groups? I can see some leadership maybe feeling threatened by that kind of culture of openness and honesty.
I think you have to model it at the top. And because I think, I was division chief for otolaryngology at the Brigham for 17 years, but who's counting anyway? And, I'm all about, like, I teach feedback. How do you give it? How do you receive it? But I hated critical feedback. I did, but I absolutely made myself model. I'm going to solicit feedback, and I'm going to give, both positive and critical, and I'm going to give myself positive and critical feedback in front of you, right? To show people, look, hey, this happened. I'm not proud of what I just did or what I, have done over the last 6 months about this problem. Here's why I did it, but I need to, regroup and show. You've got to model it. You have to show people it's not just safe to do that, but that's actually the mark of a really good leader who can do that. So I do think it's very hard to start that if you're in a vulnerable position to be like, I'm just going to talk about how I messed up, if you don't have leadership that's, can hear that, or I'm just going to tell you all the bad things you're doing as a leader without any context of like, I'm here with you to try to make things better. Here's some things would you be open to listening to some things that I think would improve? So some of it's how you say it, but also creating, I call it like a feedback culture where you just that's what you do, because that's how we learn. That is how we learn. And, I tried to do that as a leader. I didn't always do it, and wasn't always successful at it, but I sure as heck tried.
Yeah, thank you for sharing. And someone in the audience did their clapping emoji. I think they supported that, yeah, it has to be modeled from leadership, and yeah, that's so great. I had a thought, but it just left my mind. So any other questions for Jo while we've still got her? We have a few minutes left. We don't have to go all the way to 2 hours, but if anyone else had a question or wanted to chime in, this is your chance. I'm
This
just really, oh, there we go.
This is more of a like selfish question because I'm doing my grand rounds on physician well-being and mental health, and was just curious if you had any resources you could point me to.
Resources for like for your talk, or for what people should do, like in terms of mental health?
I think yeah, like either, but mostly I think more from like an organizational perspective, because I think that you know, like the point of that you made earlier about people getting cynical when you know, the workplace environment doesn't change, but you know, you're like, go to yoga, sleep more, or whatever, is very real. And so more on like an organizational, like places that you've seen that do it really well, or things like that.
No, I think that's a great question, and good luck on your grand rounds. That's great that you're doing that, Giselle. The place I would look actually is the AMA. I think they have put out really, really specific and practical approaches, different approaches to well-being in general, and some data about like why this matters, and that sort of thing, including I think things on mental health. So I usually will start there because they're just so clear, and they're all, you know, different modules, different, you know, all sorts of different ways. So I think, and then they have references that you could, you know, take off from there if you like some of the stuff you see. So I would use them a lot.
I would
Okay.
also, oh, I'll also add too that as part of this National Health Service Corps Empowerment Initiative, we've had, you know, the previous webinars in this series, we've covered some of those, and we've definitely referenced the AMA resources that Jo just mentioned. So please check those out. And we've got a developing organizational resilience guide that's up on the website. And we should have our developing organizational resilience resource compendium coming out soon. So please definitely keep an eye out for those. And we've got lots on, you know, we started out our curriculum this year on health disparities, and then we jumped into clinician burnout. So ways that you can assess burnout and look at how different experiences of burnout can be impacted, or the drivers of it can be from specific reasons in the workplace, and then how to address them. So I would definitely go back and look at those publications as well.
And Giselle, one other thing, yeah, that's great, Molly, is I think, you know, I used to hate my early talks. I just hated being asked to talk about burnout as a big topic because it felt so overwhelming. And that's what I would say. I would say, like, obviously, we would all love one program to fix all of this, and that's not going to happen, right? You're not asking me for that. If you are, you could leave now because I don't have it and nobody has it. So this idea of saying, you've got to look at it from different perspectives. I do this thing of like, you know, individual resilience, community, you know, collegial stuff, relational work, and organizational. That's just my way of like putting all the different programs in different circles, and some overlapping, but it doesn't matter how you do it. It's just this idea of saying we're going to need to hit this from various angles, and it cannot be always the individual. Do this, do that. Don't do this, don't do that. And that's always been my message with well-being.
Thank you. We've also been trying to emphasize that well in all of our talks on the topic of clinician well-being and burnout. It's and one reason we stopped talking about clinician like individual resilience, because it's more about what the organization is doing to change their practices and policies to support the workforce. So
it's yes, and you know, those things,
right.
like I should probably exercise more than I do. You know, it's not like we don't.
Sure.
But to your point, Molly, we can't ignore the other. And I also wanted to honor Molly and the team, Diane, just this, you know, for really saying we care about you all. This is a way of showing caring, which is we want to help you. We want to help you feel better, be better. And so that's, you can't, you know, that's great to have the leadership who does care. Yeah,
We really wanted to do this programming. And that's why I'm happy to see we have questions, we have the handouts, we have them on the website. It's really going to help you in your service and if you're going into service. So I thank you, Dr. Shapiro. I'm thrilled to have you here. And yes, we have all of those handouts, visual items to support what we've been discussing today.
this is what leadership who cares looks like.
Yes, Diane cares deeply. We're so glad she's here.
I do. I'm so happy that everyone was able to ask their questions and be available just to be themselves so that we can make it even better for next round.
Well, thank you. And I think on that note, we will go ahead and wrap up. But we've got our grand rounds coming up in August that I was mentioning. The Chief Executive Officer, the Chief Human Resources Officer, and the Director of Human Resources will all be sharing that day about what they're doing. And again, strongly encourage you to be there. We can put the link to the registration for that webinar in the chat to make sure you all can join us. But thank you so much for attending our session today, and thank you to our tech support team who helped make the webinar possible. We will send out the recording on Friday, and the slides are already up on the website, and you should have a link to them. Yeah, we're going to have a really great, it's also our final webinar. If you weren't here at the beginning, I mentioned that, the next webinar is the last one in the series, but also the last one in our curriculum for this year. So please join us. And also one final note is we will be sending out an end of year survey in August to assess how we did overall this year with our webinars and our publications. We'd love for you to take a few minutes to just really honestly let us know what you think and give us suggestions for next year. We really are always trying to improve and do better and make things accessible and as useful as possible for all of you. So please definitely participate in that survey. You'll get an email about it. And Joey getting some love in the chat. Thank you to everyone who was here and participated. It was wonderful. So thank you so much, and we'll go ahead and log off for today.
Take care, everybody.
Thank you all.